Nasal fractures frequently occur following facial trauma. When this situation arises, the treatment of these problems depends upon how quickly after the injury patients seek medical attention. When patients present within 3 weeks of the original injury, the bones are still freely movable. Under these circumstances, a procedure known as a closed nasal reduction can be performed. This procedure involves repositioning and resetting the nasal bones in a more normal position. Following the procedure, patients wear a nasal splint for about 1 week to stabilize the bones. We frequently see patients who present years after their original injury. Under these circumstances, the bones have healed in an abnormal position. It's not unusual for these patients to have dorsal humps, broad nasal bridges, deviation of their nasal septum, and even airway obstruction. It's important that these patients undergo a comprehensive evaluation before proceeding with surgical correction. The majority will need a rhinoplasty, but occasionally patients will need a septoplasty as well if they have nasal airway obstruction. They may need to have nasal dorsal humps corrected, and they may need to have their nose straightened and the nasal bridge narrowed. It all depends upon the physical findings and the patient's aesthetic goals. Patients who have post-traumatic nasal deformities should seek the attention of a board-certified plastic surgeon who has experience performing these types of procedures. When this approach is utilized, success rates are high and patient satisfaction rates are high as well.